Hi guys, this is Amy and thank you for joining Health Focus. We've been here the past 1 year and we are so glad 2024 has come. I want to believe that it has begun in a very good note on your side. I am not alone. We are joined with a very knowledgeable nurse, competent in her area, commanding in her scope, and I don't want to empty anything further. We'll get to know who she is. Kindly watch to the end for you to be able to learn on the much content that she has to offer. You're all welcome. You know, most of the time when I'm shooting and I'm shooting somebody from my same line of specialty, I'm always excited because I know I'm going to learn things I never learned. Let's all welcome our guest today. Karibu, Mary.
Okay, thank you so much. My name is Mary Ikaaria. I'm a nurse by profession. And on top of being a nurse, I'm a specialist in wound, stoma and incontinence care.
Wow.
Yes.
Wow. I know you don't know what all that is, you'll get to learn. But before we get to know more about wound stoma care, let's get to know Mary properly. Where did you grow up and where did you do your nursing?
Okay, I grew up in a very humble, beautiful village back in Nyeri. I grew in a village, not really a village, it was a shopping center. Ihororo Shopping Center.
Ihororo.
Yes, it is in Moya's location, Nyeri. That's where I grew. I went there for my education from nursery to Ihororo Primary School, where I did my class 8 in 1985.
Wow.
Joined Mahia Girls Secondary School in Udaya. From 86 to 89, that's where I did my 4th year exam.
So, before you joined college, did you know what you wanted to do?
Yes. When I was a small girl, my brother got sick and was admitted in Nyeri General. And so we went to visit him with a neighbor. And when we went there, I was below the age of going to enter the wards. But fortunately, I entered the ward, saw my brother, and then a nurse came now to explain to us that I am not supposed to be in the ward. But the way she handled me, I liked it. She did not scold me. She just explained to the lady we were with that with my age, I'm not supposed to be in the ward. Then she took me somewhere outside where I could pray as I wait for the lady to come out and then we go home. And from there I liked nursing. And I started telling myself I would like to be like her. And so then the uniform, white with a cape.
That's what interested
It was so interesting for me.
What did she tell you? Because so many people wonder why children are not supposed to be in the ward. What did she explain to you?
She explained to me that it is not safe for children in a language that I understood as a child because of infection, and she doesn't want me to get sick after that.
Okay.
So I was just okay with that.
So apart from the uniform and her not scolding you, nothing more in your knowledge?
In that age, there's nothing more I would have known about nursing. Yes. So when I finished, my mom was a businesswoman. We had a small shop and a hotel. And so I was not bored at home. I used to work in that small shopping and I learned a lot of business from there. That's why I always like doing small business beside my nursing career.
So how did you find yourself now getting into nursing?
So I just went there was an interview in KMTC, Nyeri. I went, attempted. I was not picked. I relaxed. Then somebody told me that also Madari Consulta Hospital.
On the private now.
I can get, that one is a missionary. I can get a chance. So I tried to check when they have an interview. I went there. We did the interview. It was oral and written. So you do written in the morning, they mark, and then the ones who qualify goes for the orals in the afternoon. And by the end of the day, you'll go home knowing whether you are going to join and which month. So I went, I passed the interview. And I actually left late like Samoja, but I went home with a letter of admission.
Excited now to join Madari.
Now excited that the nursing I have been wanting is here with me.
Wow.
Yes, that's how it happened.
I've not found somebody with such happiness.
Yes, I was so happy to join nursing.
Wow.
Yes.
So when you got into nursing school,
Yeah.
was the experience in nursing school the same as what you had anticipated or planned or foreseen?
Yeah, it was the same. So I could see some of my classmates. Actually, I think even one dropped because that is not what they expected. You know, most of the people in the rural areas, or when we finish school, we think nursing is just giving injection, giving dawa, and watching the woods.
Hey, at a point says it's dawa and taking temperatures.
So when we went there, I was excited by everything, and I felt I want to know more about nursing.
Wow.
Yes.
Wow.
Yes.
Nothing shocked you, not even death, not even pain, not even blood.
Nothing, because I remember when we went for the being taken loud, and we were taken loud, shown the wards, this. Finally, we ended up in the mortuary. And when we entered the mortuary, the door was closed. People screamed, and I was like,
Why
are you screaming?
No, but why are they closing the door?
I think the teacher just wanted to see our reaction, whether we can cope with that, because it's something we'll be seeing every day.
Not in mortuary.
The thing was, in this college, we were the students are the ones who used to release. There was a mortuary attendant.
Yes.
But when the relatives of a patient who passed come, we were to go there and assist them to
identify
the body,
God.
put clothing on the body.
Oh my goodness.
And help them to put it in the coffin.
Can I thank God that nothing changed?
Yes.
That was traumatizing.
Because the attendant was one.
Even so.
So we used to go with the relative there, and we would do that.
Wow.
Yes.
Okay, I don't know whether.
So I think they just wanted to see how we can cope with that.
I want to say I'm traumatized on their behalf for sure. It's, even me I could have screamed totally. And that didn't shock you?
No, they didn't.
So brave, Yani.
Yeah, I didn't find it something to make me
get scared
of something.
Had you encountered death before?
Yeah, but I was a young girl because my dad passed on when I was 5 years old.
Yeah, that's why you were very
And
young.
so I didn't even know what was happening.
Yeah.
I could ask, why are we having so many people in our home?
Yes.
Yeah.
So anyway, your life in nursing school was enjoyable and you finished.
Yes.
Then you found yourself now into the nursing career.
Yes.
Which you worked and enjoyed anyway.
Yeah.
Because you had dreamed to do that.
Yes.
Take us through your first initial employment. Now you're not a student under somebody, but you're the one with the patient.
Okay. My first employment, I was employed in a Catholic dispensary, somehow a clinic in Karatina, Nyeri. And I was the consultant, I was the procurement person, Anyway, I was everything. I was the pharmacist because I was working just with the support staff.
You can almost be the cleaner.
Now the support staff could do the cleaning, cook some tea we take together, but everything else, I was the one who was doing it, and I did it for 5 months before I joined my present employer in 1995.
Wow.
Yes.
Hey, that must have been a whole turmoil experience from Madari, which was a bit busy, to a dispensary where everything you were responsible.
Yes.
Wow. So in relation to this working and your nursing experience, somebody wants to join nursing. What do you think are the best qualities of that person?
Nursing is a good career, but if you don't have it in heart, please don't try.
Don't try it.
Don't try it. It needs a lot of patience, listening, good communication, understanding your colleagues and the patients. You need to have a lot of skills, different skills, for you to be a good nurse.
Wow.
Yes.
I want us to now come to the current specialization.
Yes.
Let us, what is it? What is wound, stoma and incontinence? What is all that career?
Okay. After working in surgical department for quite some years, because I think during my 28 years of nursing experience, I've worked 18 years in the surgical department. And when I was in the surgical department, there are two people that I felt they're suffering much. And I could not do much with the little education I got in the area of wounds in the college, because it was not explored.
Yes.
It was just aseptic technique, the step of doing wound dressing. But it was not deep into how do I assess this wound? How do I make a decision of what to use on this wound? And how do I assess the progress of that wound? So after working in the surgical department for quite some years, there are two categories of patients that I felt I was not able to take good care of them the way I would have wanted. One, maybe because of not having enough knowledge on that, and two, because of maybe not having resources. But how could I have asked for resources without the knowledge? So there's this patient with a stoma. A stoma is a surgically created hole on the stomach, which helps our patient to excrete, to pass through. It can be stool, it can be urine, it can be sputum. All those are stomas.
Yeah, it could be a stoma here.
Yes, because it is a surgically made hole. Okay. So a tracheostomy is a surgically made, a gastrostomy, a colostomy, an ileostomy, a ulostomy.
There's so many holes surgeons.
Yes, yeah, there are so many holes surgeons make. So especially I could see patients with the stoma, the colostomy, the ileostomy, because they are the most ones that you experience in surgical department. There was a gap in their care.
There is a gap even now.
Yes. So having noted that, and I started, like in stoma, I started with stoma. I started trying to get to know, because you could see this patient is withdrawn. They are not happy.
It's traumatizing.
It is traumatizing and stigmatizing. And even if I put myself in that on a shoe, I think I would have acted the same. You're here with people who cannot give you enough knowledge of what to do with your stoma.
But they also don't know.
Yes. So there came a company called Harris in Westlands. They started a Saturday program. I think we were going once, was it on the every third weekend, Saturday. And they could give us some information, training about stomach care and products.
distributes wound care products.
Wound care and stomach care products. So I think when they started bringing those, they realized that so many people don't know about the products or even the care. So they started training. So that's how somebody told me there's a training, and I joined because I was really thinking about these two categories of patients. But mostly we were dealing with stomas. And then as we were going on, there came this program, a twinning program between Australia and Kenya. And it was in Aga Khan Hospital. So I was lucky that I got a chance to be one of their trainees, because it was to learn for 3 years. So they took 3 cohorts. That's so I was in the cohort of 2015. I went through the training. We were about 5 of us from KNH, but I was in the second cohort. The first cohort had already trained 3 from KNH. So the second cohort, we went 5 of us. And the third cohort, 2 more joined us. So in total, in KNH, we were 9 of us. So we went through the training. Those nurses from Australia who are specialists in wound, ostomy, and continence care are the ones who are learning the training. And we did it in 3 modules. They could come for 3 weeks. They break and give us some assignments to do clinical assignment and all that. Then they come again. They came 3 times.
So this duration of 3 years, you said?
Yes, but within 3 years, they had 3 cohorts.
Oh, okay.
So as we were in the second cohort.
How long is that course when you did it?
It was like a year. Because they came 3 weeks. They could go, because they used to use their own time from when they are free from duties, the other side. So they could come, teach, go back. Actually, when they started, they were even coming with visiting visa, not as coming to train.
Oh, they were offering their knowledge because there was a gap in this.
Yes, they had. I think one of them, the one who was the reader, she was called Elizabeth English. She had visited Kenya area, and she felt that gap, and then she made arrangement with Aga Khan so that we can train that.
Awesome.
Yeah.
So at the end of the training, you now are equipped with skills and knowledge.
Yes.
And now you are 9 in the
Now
hospital.
I'm so excited when I come and do things in the ward and people see like, really?
Were there products of this stomach care?
Not really. We had some bags, but not quality bags.
The colostomy bags.
The colostomy bags, we used to have a very simple plastic bag where you could put that bag after some minutes or hours. The patient is telling you, sister, it's leaking. So you could use like 5 or more every day. But now, since we have trained, these nurses used to come with products from their place to teach us. They used to come with bags of products, both wound care, stomach care, and continence care. So we did not have a gap during the training. We had everything which we needed for teaching. But now when you go back to your working place, they're not there.
Then now the procurement process of getting them, was it easy?
It was not easy, but we pushed, and I thank our surgical department because they listened to us after seeing what we are doing in the wards, after seeing the improvement of quality of care of patients with wounds and stomas. They really supported us.
So these products, after the patient is able to have them in the hospital, when they go home, are they able to access them still?
They're not able to access them from the hospital, but we could direct them to now like Harley's. I think by then, there were only 2 companies that had those products. There was Harley's and another one in Westlands called Pyramid Limited. They were dealing with bags and wound care products, colostomy bags and wound care products. The same with Harley's. They were doing the same. But Harley's, I think they had other items, but they still stocked wound care and stomach care items.
So to patients who need these products or who need to either get colostomy bags or anything, and I know they are not cheap.
They are not.
So whenever they're going to get these products and they do not have, what else can they use?
It is not easy, but patients are also innovative. Because you could find patients who have used you see the plastic paper bags polythene bags that we used to pack with them food for the refrigerator. There are those who could improvise it.
And put a sellotape.
Put a sellotape out there, especially those for colostomy. You know, colostomy is formed, it will bring out formed stool. Those ones could survive well. But now for an ileostomy, it was not easy for improvising such things.
So they need to have colostomy bags,
yes.
ileostomy bags
yes.
for them to be able to do that.
But luckily, when we started now practicing, the same nurses from Australia, 2 of them were working with palliative care units. And they happened to be able to start a support group. When the support group started, the same nurses from Australia facilitated some donations.
Okay.
So that is how we were able to support the patients. Because before they are discharged from the ward, we would advise them to join the support group. So even if they go out there and they miss the product, they could get the product from the support group. Yeah.
Wow. So you have finished, you're now working in
yes.
the surgical department, you're taking care of, we've dealt with stoma as much. Apart from the products and everything, how are stomas taken care of?
One about a stoma, these patients are very, very much affected and stigmatized, both by the community and themselves. They don't accept themselves easily.
I know there are people watching and they don't know what you're talking about.
Yes.
I know we are talking medical language. Let's bring it down to the layman's language.
Yes.
You said that it's a surgical created orifice opening. So when you're talking about a stoma of the colon, it is the colon.
It is the colon that has been brought out.
Instead of going to the rectum.
Instead of going to the rectum and you go the normal way, the colon has been brought out on your skin.
Yes.
And then you will pass the fecal matter from there.
And it just comes.
Yeah, the difference is when you are doing it the normal way, through the anus, the anus has the sphincters as the gates.
Which will close
and open. But now a stoma does not have that. So the fecal matter can come anytime. That's why these patients need to have a bag. So that anytime it comes out, it finds a discover. Yes.
And when it's full, this bag is clear.
The good thing with the bag, we have different types of bags.
Yes.
So we usually advise our patient to use a drainable bag, whereby they will just drain the content, but the bag stays. And they can keep it for 3 days.
I have not encountered this technology.
Yes,
I think
they can. But there are different types of bags. There's a closed one. A closed one means after it is full,
discard.
You just remove and discard. But the drainable one, you advise them when it is halfway, that to halfway, they drain.
So this is the reason why patients are very traumatized, very depressed. Caregivers don't know what to do.
Yes.
It is expensive to have these bags. When I was a young nurse, I thought that it is very painful. I thought that stoma is very painful.
A stoma is not painful. A stoma is not sensitive. So even if you traumatize it, you might traumatize it and stay without knowing you traumatized it.
Oh, it's not?
You can only observe when you are doing the care that, or if it breathes, but you not feel pain.
Oh.
The way I can get a cut and I've been cut because I'm feeling pain. For the stoma, it doesn't.
Oh.
So it is a pain-free thing. The only time you feel pain is post-op because you have another wound. but the stoma itself is not painful.
Okay.
Yes.
Same with the ileostomy.
Ileostomy. In stoma is a general word, the hole. That is the stoma. But in stoma, we have different types of stoma. If it has been brought out from the colon, it is a colostomy. If it has been brought out from the ileum, it is an ileostomy. There's another stoma for urinary system we call urostomy or ileoconduit. Why it is called ileoconduit is because an ileum is borrowed to be attached to the ureters, and then now the ileum is the one which is brought out to the skin.
Also, you capture urine before it gets to the bladder.
Yes. There's this young man, a Muslim,
Yes.
who was my patient the initial times when we opened the wound care clinic. We really worked on that young man, but the wound could not improve.